Hello everyone, today we're going to discuss disc displacement and some spinal interventions to help with the rehab process of someone with a slipped disc. We focus specifically on the thoracic region, so that's what we'll be discussing today, and with me I have
Jakayla.
And I'm Seth. So just to start off with the objectives, we're going to discuss 3 problems with associated disc displacement. Identify supporting interventions to address the problems and explain how the supporting interventions may address those problems and how we're going to work around and treat the symptoms and not the diagnosis itself. The impairment/dysfunctions that we decided on are decreased extensibility, decreased range of motion, and impaired respiratory mechanics.
So first we have decreased extensibility. For our maximum protection phase, I'm gonna get my patient sideline. Which way you want me to face? Which way you want me to face? Alright, and what I want to tell them to do is act like they split open the book. So you're gonna take this on. Patient do this about 3 sets of 10, and this is used to increase thoracic mobility, specifically rotation and extension, while keeping the spine stable. Alright, for our next one, we're going to do the cat-cow. So you're going to have your patient on all fours. For the cow position, you're going to ask the patient to put an arch in their spine. So can you put an arch in your spine and lift your head up? And then you're going to have them hold that for about 5 seconds. And then they're going to go into the cat position. Put a hump in your back, put your head down. And hold that for about 5 to 10 seconds. And I would do each position 2 sets 10 times. This increases spinal mobility, and it promotes gentle extension and flexion without excessively loading the spine. And for the minimum protection phase is a stretch called the threads and needle. So basically what you're gonna do is you're gonna get on all fours again, and then you're gonna bring this arm up a little bit. And then you're gonna bring this arm through there. Stretch it out. And hold that for about 5 to 10 seconds. Switch side. And this just enhances, again, rotation and extension.
Okay. Next, we will be discussing the interventions for decreased range of motion. During the max protection phase, you can have your patient perform thoracic spine extension, which improves flexibility, posture, and the patient's range of motion. Thoracic spine rotation, which improves rotation, range of motion, and it also decreases stiffness. And you can also do thoracic spine bending, side flexion, which improves side bending, range of motion. Excuse me. With these, you can have your patient seated to do all 3 of them if you want to just keep your patient in one place. Either of you have a seat. I'll just do one. We'll do thoracic side spine bending. With this, you can have your patient have their arms behind their head, or if that position is uncomfortable for some of them, you can just tell them to have their hands at their hips. It just depends on the patient and their comfortability, and you're just going to ask them to slightly scooch to the edge just a little bit. Just a little. There we go. And I want you to bring your elbow down to your side as far as you can. And you want to ask them to hold these positions for 8 to 10 seconds, and you want to tell them to repeat them 8 to 10 times. And then you're going to go to the other side. And again, all of these improve mobility and also the patient's flexibility of their spine. All right, we can stop kicking. Thank you. During the moderate protection phase, you can have your patient perform arm slides on the walls and also scapular squeezes. With those, you want them to perform 3 sets of 8 to 10. These two exercises improves posture and scapular mobility, and it also strengthens the back and shoulder muscles. To have my patient perform scapular squeezes, you want to tell them to sit up straight, shoulders back, and I want you to bring your shoulders back and act as if you're trying to pinch a pencil in between your back, and just hold it for 8 to 10 seconds. So you just want to squeeze and then relax. And then also to help them, if you want, you can kind of like place your hand at the back of their back to tell them exactly where you want them to focus on squeezing and holding that position. Next, during the minimum protection phase, you can have your patient perform prone T exercises and also rowing exercises. Those two exercises, you can have them again perform 3 sets of 8 to 10, and with those, you want them to hold it for 3 to 5 seconds. These two exercises improves not only their posture, but it also strengthens their back muscles and increases their range of motion. You can lie down prone on the on your stomach. Make your patient comfortable. You also want to have your patient tell them to turn their face to the side for comfortability. Yep. And you want to have them make a T, arms straight out. Yes. Yep. There we go. And bring your arms slightly down. You just want to bring them up as far as you can. Just hold for about 3 to 5 seconds. Bring them back down. Yep. Bring them back up. You can also progress this by having them hold a weight. So that's another option. You can get up.
So the next interventions that we're going to cover are for the impaired respiratory mechanics. So with the thoracic spine, you have a lot of mobility for the chest wall to be able to expand and contract for inhaling and exhaling. So it's very important that those muscles aren't impaired by the injury itself. And it's one of the first ways that the injury will show up. Once you have a slipped disc or an injury to your thoracic spine in any way, the first thing that gets hindered is you start guarding your breath because you don't want to take a full breath because that would cause you pain. So one of the max protection phase interventions that I would implement would be diaphragmatic breathing exercises, just to make sure that that musculature isn't kind of atrophying due to the lack of use because of that guarded breath. So, do you care if you'll sit on the plank for me? So the instructions I would give to my patient when implementing these exercises is to sit comfortably with your knees bent and your shoulders, head, and neck relaxed. Place one hand on your upper chest and the other just above your rib cage. This will allow you to feel your diaphragm move as you breathe. And breathe in slowly through your nose that your stomach moves out against your hand, but your chest stays the same level. And then once you have that full expansion, hold that for a couple seconds, and then exhale with the hand on your stomach moving and your chest hand staying the same. So this is going to strengthen that diaphragm and allow you to get a full deep breath without drastically changing the position of your thoracic spine, which would minimize that pain that your patient might be experiencing. Another couple interventions in this phase would be some rib mobilizations of the thoracic spine, which we haven't quite covered yet in this class, but you know, those are very mobile joints that allow for that expansion, and that's going to be very important for your patient's ability to get a full breath. In the moderate protection phase, we would do some inspiratory muscle training through some resistive exercises. So the ribcage flexibility and the exercises presented, they can either take place internally or externally. So with externally, we would have a band wrapped around, place that roughly around your diaphragm, and then have them inhale and exhale against the resistance band to kind of to strengthen concentrically and eccentrically the musculature required for that chest expansion. And then we can also do it positionally. So if you wanted to increase the strain on the pulmonary system to get a full breath, you'd have them lay supine, and then you could even ask them to pick their heels up off the table and then take deep breaths that way while their core is engaged to kind of fight that to fight that pressure, which can be pretty difficult for some people. And then for the minimum protection phase, it's the functional breathing patterns while doing certain exercises. So for instance, if we were to apply this to some of the exercises we mentioned before in say a like cat-cow position, when you take a full inhale, your thoracic spine will go into extension So you'd want to pair that with the cat position, and then with a full exhale, it'll go into flexion, so you pair that with the cow position as well. So whenever you're doing those scapular exercises combined with the breathing, it will help you breathe functionally, which will apply better in your daily life so that you won't have to pause or feel like you're out of breath because you're not able to breathe correctly while performing certain ADLs. And these are our references. Does anyone have any questions?
Any questions?
I might have missed it. What's something that you can do instead of wrapping around, just in case that's uncomfortable or difficult for the?
I would switch to the positional if they can't tolerate something like. I definitely wouldn't use a cornered band like this. I'd use a flat kind of Therex band. But if that's uncomfortable for them, I would stick with positional. And even for the super low level patients, something like just sitting supine may be enough for them, depending on how much tissue they have on their abdomen or anything like that. But just changing their position to make it a little difficult would be better.
Can you tell me how the core is important for these exercises?
Yeah, like for the breathing itself. So motion at the spine is going to happen every time you take a breath in and breath out. So if that disc displacement is causing you pain, you need to be able to breathe functionally, but also not lose the musculature involved in taking a deep breath. So being able to mitigate that with the correct breathing patterns and also strengthening those muscles with the exercises provided are just the best way to ensure that you're not going to lose or atrophy your diaphragm or anything like that.
Can you go back to the inner picture slide for me?
For which one?
I think was your prone T's.
Prone T.
Okay. So the prone T exercise, it says that person, right, the image, it says it's a mid-trap exercise. What makes that a mid-trap exercise?
The arms are out in this position and their thumbs are up.
Okay, so you should have emphasized that in your demonstration. So make sure the thumbs are up. But now, why in the world would he emphasize the mid-trap with the thumbs being up?
When your thumbs are up, it's going to align that contraction of the insertion of the trap better for your scapula, so it's going to create like a more direct line of pull with the muscle. It's going to activate it specifically more.
Why is that?
Due to its insertion on the humerus. So when it's going from the humerus on the lateral side, by externally rotating, it's creating a straighter line of pull towards your scapula.
Good job, Sel. That's what I wanted to hear. So the GH joint is in external rotation. And because the GH joint is in external rotation, with going in the prone, going into horizontal abduction, you're all is going to recruit the mid trap. So you need to know that. So for example, if I come right here, right? I come right here. I place my arm right here. And say I have my patient performing external rotation like so, right? External rotation in the sagittal plane. So I have my patient performing external rotation in the sagittal plane on the table like this. In order for them to get full external rotation like so, what other muscle is going to be being recruited?
Infraspinatus and mid-trap.
Mid-trap. So mid-trap is going to have to be able to kick in order for me to achieve full external rotation in this sagittal plane. So in this case, with the thumbs being up, with it putting the GH joint being in external rotation is recruiting the mid-trap. Now, what if I internally rotate and put my thumbs down?
Posterior deltoid.
Posterior deltoid, and what else?
The upper trap.
You need to know this. Rhomboids. So you're isolating the rhomboids. So when you put the thumb down and put the arm into internal rotation, then you're isolating the rhomboids. Now you're gonna work the rhomboids more with the thumbs down. Does that make sense? But I'm taking time to go over this because you may see this again and no one wants to extrapolate that. You all want to be told it straightforward, right? You want me to go ahead and disclose that straightforward. So you're likely gonna see that again. The difference between thumb up and thumb down, but I've given you the explanation as to why based on muscle action, origin, insertion, like what Seth said. So now when you internally rotate, you take the mid trap out of play, and now you got more emphasis on the rhomboid major, rhomboid minor, right? You would not have wanted to extrapolate that, wouldn't you? You rather just have that straightforward told to you, right? I see Andrew smiling. Why are you smiling about that, Andrew? All right. Growing exercise. Okay. Go back. Okay, come back. Come back. Right there. Okay, the arm slide on the wall. Talk about this a little bit more to me.
It'll just improve like scapular mobility and also like improve their posture. Versus having them like this, it'll allow their arms and shoulders to be like rolled back in order to perform it, which will improve their posture and again their scapular mobility.
Okay. Well, let's take it a little bit deeper because you don't want to extrapolate this. You want this straightforward. You may see this again. So, you made a good point about bringing them out of that forward bent position or forward head position, and you want to straighten them up, right? You want to make them more erect in the thoracic spine. So, what's the significance of the thoracic spine when it comes to moving overhead mobility of the upper extremities? What is required of the thoracic spine? Extension. Okay? So if you get patients and they lack extension of the thoracic spine, it's a likability that they're gonna lack full overhead mobility of the upper extremities, because thoracic extension is required, like full thoracic extension is required for overhead mobility. Does that make sense? So I go flex my shoulders. What does it require? That requires thoracic spine extension. So thoracic extension is very essential and complementary to overhead mobility. Does that make sense? All right. Anything else?
Any more questions?
Go backwards.
Step back.
Yeah.
Hey, did we do this last week, guys? I can't remember if we talked about this in here, but did you all try this yourself, get in this position, this slumped position? Try to raise, and then sit up and try to raise, right? Did we do that last week? Yes. Because you can feel it, and I use that as a tool to teach my patients a lot. I'll demonstrate. Good tools.
Now, Kiki already told me you don't want to have to extrapolate this. So, but you can see this again, right? Kiki. So if you have patients doing thoracic book openers, what do you so it says to increase thoracic mobility, rotation and extension while keeping the spine stable. Okay. So Used to increase thoracic mobility, rotation, and extension. Very fascinating. Very, very fascinating. Kentoria, why do I say very, very fascinating?
Cause they extrapolate the, motions right there. So why you saying
Okay. Kira, why do I say very, very fascinating? All right, Kira said because it is. So they have to improve rotation and extension. Very, very fascinating. That's not incorrect. That's correct. But could it possibly also improve something else? Now this is what I mean by extrapolation. We don't want to do it. We complain like, man, there's some Dr. Carter probably gonna say we gotta extrapolate. There's probably something Dr. Carter say we have to extrapolate. Could this possibly improve something else?
I was thinking,
Cervical rotation.
oh, never mind.
Go
I was
to
thinking maybe it could increase opening up the chest cavity for breathing.
Okay. Yeah. Mm-hmm.
cervical
What
rotation.
other motion?
Cervical rotation.
Okay, cervical rotation, yeah. Cervical spine can play a role, but I'm talking about thoracic mobility. Are there any other motions that can be improved besides rotation and extension?
Would be flexion. Because if one part is extending and the other part is flexing.
Go a little bit more, let me know what you're thinking on that.
So when you're rotating and you're extending with the upper portion of your thoracic spine, the flexion has to take place between that and the lumbar to keep that kyphotic curve.
Okay, you can think of it like from that region, from that aspect. So I'm thinking orthokinematically. So we've learned our orthokinematics, right? So in this case, we have someone who is lying down and rotating. So they're taking their left hand, so in this case, the right hand is flat, they're taking their left hand and moving their left hand backwards. So the thoracic spine is actually rotating to the right. So the thoracic spine is rotating to the right. What are we getting on the right facet? We're getting an anterior glide, right? And on the left, we're getting a posterior glide. But if we get an anterior glide, what other movement is anterior glide required for? Flexion. So could this potentially improve flexion? Yeah, so by the time you do it on both sides, and you have the patient to do it to both sides, and now orthokinematically can improve flexion as well. See, that's why you have to be logged in. You gotta be plugged in, you gotta be locked in. You gotta lock in. Right? So this is how you gotta be thinking when you read your reading assignments as well. You see, you gotta be extrapolating as you read. You see? So, what did I just say? I'm gonna have one of your classmates to say it.
Since by doing rotation, so you know with rotation to either side, you're gonna have an anterior glide to the side that you're rotating on. And so since you have to have an anterior glide, that's gonna improve flexion as well because when you do flexion, it's an anterior glide.
Now, if I'm improving rotation, Could I be improving side bending as well?
Yes.
Somebody said yes. Who said yes? Who in the world would say yes to that? Who in the world would say yes to that? Who in the world would say yes to that? Who in their right mind would say yes to that?
I did. I did.
You did.
I did.
Okay, why would you say yes to that?
Because it's the same motions, pretty much arthrokinetically.
So arthrokinetically, in the thoracolumbar spine, when you perform rotation, so say you in the in a cardinal plane, all right? So when you perform rotation non-functionally, right, you have side bending to occur to the opposite side, right?
Right.
And when you perform it functionally, you have it occur to the same side, right?
Right.
So in that case, rotation can also improve side bending arthrokinematically. If you're thinking about your non-functional and functional arthrokinematics of the thoracolumbar spine. You see? But it's all extrapolation. It's all extrapolation. So you get hit with a question like that, and I hit you with a question like that, you're like, where in the world is Dr. Carter coming from? What is this talking about? What is he talking about? How in the world could that be? It's arthrokinematics. It's straight on from what you learned. It's straight from the textbook of what you learned arthrokinematically. But when you see it in the question format, you're thrown off. And especially when you see some answer choices that look crazy to you, but it's all arthrokinematically. So now you gotta go back and have a command of arthrokinematics of the spine with functional and non-functional movement. That's those Friat laws. But I like to just say non-functional, functional movement. That makes it easier for me to wrap my head around it and command the content. You see? But the reason why I'm going over this, because you can see something on the written exam that could be something that you have to extrapolate, but you know it, but you have a tough time extrapolating it. But it's basic arthrokinematic content. Does that make sense? Does that make sense?
It does. Yes, sir.
Does that make sense?
Yes, sir.
Okay. I just want to make sure I do this. I just want to make sure I emphasize this today. This was on my, this became a topic to put on my list today with extrapolation. All of a sudden it just became a topic for me. Got it? Okay. Keep moving. Oh, cat-cow pose. Who demonstrated that? What's going on with that?
Demonstrated or discussed? She was one on the table.
She demonstrated on the table? Okay, let's see it again. That's the what? Cat?
Cat.
That's the cat. What does the cat improve? The cat is working on what?
Flexion.
Flexion, right? So the cat is working on flexion. Indirectly, what else can it improve? Rotation, because flexion, anterior glide has to occur for rotation. Right? So I can have her to do this before I do book openers. You see? I say, okay, let's do some cats with the emphasis on the cats, but we're doing cat-cow, and I can have her to do this before we do the book openers, right?
What if this also lengthen the extensors?
Yes.
So we can do eccentric extension.
Yeah. Mm-hmm. There you go, Tia. You thinking, Tia, like a therapist. So good. All right. Now, cow. Go through the cow. Could the cow also improve rotation?
Yeah, to the opposite side.
What you say?
So yeah, to the opposite side.
Yeah, because a posterior glide has to occur on one side, right? Good job. Good. All right. So I'm trying to get y'all to think beyond, so you can use, see, this is my protection phase, and I'm teaching you all and informing you all, and they got a good progression, but you need to know why. You know, you need to know why. And when you get up there and teach it and explain it, I want y'all to dig a little bit deeper into your why. You know, start using your foundational knowledge, your foundational content, because basically that's what I use with my patients all day long. I have them to do something, and then I give them the foundations as to why they're doing it, you know. All right, go ahead. This is a good one. Enhances rotation and extension. So also now we know that this can enhance also what? Side bending as well, okay? Indirectly. And go back. Go back. Go back. Go back. We'll talk about that. We'll talk about that. Okay. Now, hold. So, diaphragmatic breathing exercises, abdominal expansion, rib mobility techniques, mobilization of costovertebral joints. And so I heard somebody talk about the influence of the, did somebody say core muscles? Okay, what do you say? Ebony asked. What did you ask, Ebony?
Why were muscles important for breathing exercises?
Okay, why the core muscles important for breathing exercises? That is a very important question, and we need to understand it as PTs. So first of all, what we need to understand as PTs is what makes up the core. You may want to write this down. What makes up the core? You want me to tell you, or you gonna tell me?
The multiple layers of abdominal muscles, the diaphragm, the obliques.
Thank you for your participation.
And also the psoas is connected to the diaphragm, so I guess they kind of stand.
Oh, wow, very good job. The psoas is connected to the diaphragm. How is that?
It's connected in a way that, you know, whenever you get done exercising, you feel the need to bend over to breathe, so that's your body telling you to provide some slack in that muscle so that you can get a deeper breath.
So there's a structure called the tendinosus crura. And the tendinosus crura connects the psoas to the diaphragm. So now, if your psoas is taut or weak, that can affect your breathing, the capability of your diaphragm to fully expand, because now you have a tight psoas muscle pulling down on that diaphragm and restricting the diaphragm. Good job, Seth. Where'd you learn that?
Well, it was because I was learning about like exercise and why you feel the need to bend over. Just because I saw the article saying that it doesn't actually help your oxygen perfusion at all to stand up. You know, all your football coaches tell you stand up and take a deep breath. It doesn't help at all. It's totally fine to bend over because it's not going to change your perfusion rate. So I
Okay,
just read an article about it.
so you've been reading. That's good. That's where it's at. The information is there. You have to read it. So now that takes me back. Could the psoas muscle be a core muscle? I ain't hear anybody say psoas at first. Yes. Now that takes me back to what makes up the core. I see your way. You can't like it. Okay, lumbar region, pelvis and hip. Typically they refer to it as lumbopelvic hip region. It's referred to as our core. The gluteus maximus muscle, is it part of our core? Gluteus medius muscle, is that part of our core? Pectus neus, obturator internus, obturator externus, piriformis. All of those muscles are part of the core. Iliacus, psoas, core muscles. Proximal aspect of the rectus femoris, core muscle. Proximal sartorius, core muscle. Any muscle of the lumbopelvic hip region is the core. So when you're doing squats, you're working on core musculature. When you're doing lunges, you're working on core musculature. So now, core musculature, it is very important that we don't have muscle imbalances of the core musculature, which is where mostly all of us have muscle imbalances, including myself. And I'm conscious of it, so I go to the gym and I intentionally work on it. Stretching, strengthening, stretching, strengthening, stretching, strengthening. Right? You probably hit on this in sports PT. I know I emphasized it when I taught sports PT. What truly makes up the core? Lumbopelvic hip region. All right? All the muscles of the lumbar region, muscles of the pelvis, muscles of the hip, all make up core. All right? So now, core muscles can influence breathing. All right? Now, I'm not gonna go into all of this, but yes. Also, there are secondary, what they call it? Secondary accessory muscles that influence breathing as well, right? You all know those, right? What are those? Scalene.
CSM, upper traps.
Yep, up trap, sternocleidomastoid, serratus anterior, all of these. What about latissimus dorsi?
Yep.
Yeah, it is too. It's often overlooked as a secondary accessory muscle for breathing. It's often overlooked. So, good job. But they just open up a teachable moment with that. All right, go back. Okay, good, go back. All right, that's it.